guys, my name is Taylor Reed with Reed Striking and Fitness. I'm a personal trainer and fighter as well as entrepreneur, and today I'm super excited to be talking with Dr. Rountree at Montana Laser. So, of course, I know you are because we've worked together a little bit, but for those that don't know, can you give us a little bit of background on who you are?
Yeah. So I grew up here in the Valley Valley. I grew up actually in a chiropractic office after I'd had a car accident. I was getting treated for the symptoms there and got interested in chiropractic and healthcare in general. And so I went through chiropractic school, went through the military as well, U.S. Marine Corps, and ended up in a laser therapy practice out on the East Coast learning about, that's where I was really first exposed to laser as the modality that it's become in healthcare. So I was able to learn a lot about that, and then thankfully be able to move back to the Valley and start this clinic up here to provide laser to those that we know here in the Valley.
Awesome. So, and how long have you been here in the Valley so far? After going off and you're in the Marines, you were studying things like that at school, and then you came back here. How long have you been here now?
Yes, we moved back in November of 2015.
Awesome.
And then started getting this place up and rolling in February of 16. So I've just been, it's about 2.5, going on 3 years now that I've been back.
Awesome.
And I love being back, love the Valley.
That's so cool.
Yeah.
Dude. And I'm super excited. I've been loving the weather here. I mean, we haven't had snow yet, which has been great for me. I don't know, but there's a lot of skiers out. As far as laser, when we start talking about that, again, I know what it is, but we're, if someone's new to it, hasn't heard of it, what exactly is laser?
So laser therapy is a modality. It's actually originated with physical therapy and veterinary medicine. Is where it really first kind of got a go. But laser itself is a non-invasive way to deliver infrared and red light into deeper tissues. And once that light gets in there, it starts to generate increased blood flow, increased oxygen delivery to the tissues, and it even speeds up the metabolism of especially damaged tissues. So you get an accelerated healing response from the body. And that's really big when you're talking about tissues that typically won't regenerate, like cartilage, or nerve endings, but also you can speed up the recovery of tissues post-injury or post-workout as well.
Which is great, especially for someone like me as an athlete. I've been loving this because the recovery process has increased, especially when you start hitting split routines. You hit a morning and an evening. For bodybuilders especially, I feel like when they're hitting their split routines in a workout, recovery is huge. Anyone in athletics knows that really it's not the work itself, it's the recovery afterwards that wrecks, especially when you're in a hard camp. So when we start talking about specific things that are treated, we start talking about neuropathy. But, I understand that because, I can track with that lingo. But let's kind of break it down for someone who's never heard those terms and quite understand it. What are we talking about when we start that healing process?
So for neuropathy in particular, you've got some kind of nerve damage that's happened. And that can happen when you have a compression to a nerve. But a lot of times it happens with diabetes and those complications or post-chemotherapy. Some people go through chemotherapy and it actually destroys some of the nerve endings in the hands, the fingers, and the feet. And the problem with neuropathy is that there's not a treatment out there in the traditional medical realm that addresses not only the symptoms, but actually trying to reverse that condition. So the usual care for that is going to be gabapentin or some of the medications that the neurologist will prescribe in an effort to kind of tone down the symptoms, but you don't really get recovered function. When we can get laser into those tissues, into those damaged nerve endings, what happens is the body starts to actually rebuild them. So it does take some time, but you can get the nerves, that damage, to reverse, you get function back. And so we get people off of these prescription medications all the time that have had to be on them for years just because they were suffering so much.
Which is huge because for those of you that haven't been on some sort of hard prescription medication for something, it's a game changer being able to get off that. I mean, there's so many other side effects that come with that medication, and we're kind of in a limbo as far as in the medical community because in some instances we think there's a drug that might help. It hasn't necessarily been tested, but you're kind of in a state of, well, what do you do? Because you either can give it and see positive effects, but we also don't know what those effects are 30 years from taking that. So it's like, well, do you not give it? And then, and then have issues, or do you give it and have issues down the line? So I think it's awesome whenever we have, like you said, a non-invasive way of coming in, there's no side effects, there's no other health complications.
Right.
I feel like it's such a better channel to try to take.
It is, yeah, because it works with the body's own mechanisms, right? We're designed to heal. Our bodies are supposed to heal themselves. And so if we can stimulate just that action rather than medicating or chemically altering the body, then you're going to have better results no matter what type of health condition you might be working on. And just to go off of what you said a minute ago, we don't know what these effects from some of these medications are. Darvocet, you probably don't remember Darvocet. I was prescribed Darvocet. We've got a lot of patients that have been on Darvocet in the past. It was on the market for over 50 years. It was just taken off the market about 10 years ago because it was causing heart failure. I mean, it was that long that people were on it. And so we don't even know some of these medications we're giving. We may not find out about some of the negative effects until later. So anytime we can avoid those medications when possible and do something that uses the body's natural mechanisms, you're going to have a better outcome.
Absolutely, 100% agree. You guys, I'll go ahead and I'll show you a little box down the corner here of what laser looks like. How long does a laser treatment take?
Most of our treatments are between 5 and 10 minutes.
It's quick.
It's very quick. Yeah, you can be in and then out and then back with your life, which is neat. We've got these machines now that are extremely high tech. Some of the older machines that I started with on laser, some of our treatments are 30 to 45 minutes. And they can do some good, definitely, but that's a real inconvenience to a lot of people.
It's a long time.
Yeah.
Yeah, whereas this setup, you come in quick, boom, and you're done. So you can do this really quickly in the morning on your way to work.
Oh, yeah.
Yeah, so that's really convenient as far as that goes. And then, you guys, it's Montana Laser, you laser here. What are some of the other things that you guys are doing and expanding on in your own business in the medical world here?
Right. So I am a chiropractor. I do some chiropractic adjusting when that's needed as well. We really focus on the laser, and everything else kind of works in support of that. So another thing we're doing is stem cell injections. And with stem cell, that's a way to facilitate and drive tissue regeneration, specifically cartilage. So we've got that person with a worn out and arthritic knee or joint, and it's not functioning anymore because it's gone through too much wear and tear, old injuries. Maybe the person doesn't want to go through the joint replacement circus, or they aren't eligible for it. To be able to go ahead and do an injection of, again, it's using the body's natural mechanisms, but live stem cell from the human umbilical cord that's been donated after birth, and get those cells in there where they can start actively building new cartilage. It restores function of that joint, and that's supported actually by lasers. So we do both. We team those together to where they feed each other, and we get very, very good results with laser, but also the combination of stem cell therapy and laser.
So you guys, what I'm so fascinated about this is pretty high-tech stuff as far as, this is kind of cutting edge as far as what's happening in the medical community, and we're having it in a place in Montana. I don't know, for me personally, I always want to go the non-surgery route whenever possible. Especially as an athlete, I pray I never have to go that route.
Right.
Yeah, I don't want to do that. I've seen people have to deal with that. One of my sparring partners had an ACL surgery, and he never fought the same afterwards. It was never quite. There was always scar tissue, things like that. So, correct me if I'm wrong, but what I'm hearing is what let's say you have an injury like a knee issue. Mm-hmm. You're able to take those stem cells, you're able to inject them, and you're able to get the body to essentially start producing its own tissue.
That's exactly right.
Yeah. So you're allowing the body to self-heal itself.
That's right. And so instead of replacing a piece of a joint or cutting something out, we're letting the body grow that tissue back to where it, ideally goes back to 100% function. And I think that's where we really want to focus. We've got this opioid epidemic that is really catching the news. Finally, it's been years. I've been talking about it for years, but finally getting some attention. And that's because people are functioning poorly and they're in pain. If we can reverse both of those, reverse that pain and improve that function, get people back to where they function correctly, that's a big deal. But we have to have actual tissue repair to do that. And that either needs to happen through laser or stem cell or some of the other regenerative therapies that can be done.
Absolutely. Guys, I really love this. I started doing this before my last fight, and one thing that I noticed as an athlete is that I love so much is that because I can tell if I have a small increase or a large increase in, let's say, lifting for weight. I power lift, I do that all the time. So let's say my bench increases by 3%. Well, 3% is a lot when you're pushing hundreds of pounds. So I'm able to tell very quickly. And what I loved about laser is that when I'm doing it, First off, it's quick, so I'm on a tight schedule, between working and then, training, things like that, training other people. But then also I was able to go longer without lifting in the same amount of time with same regeneration to be able to hit the same numbers. So instead of benching once a week, so I come in every 6 days, 6 to 7 days, I'm able to extend that to like 10 days and still hit the same numbers. Well, that's huge as an athlete, especially if you're doing split routines. And let's say lifting isn't your primary sport. Let's say it's soccer. Well, then you're able to focus on the technical aspects of soccer and not wear your body out so much with the lifting aspect. So that's kind of more of a niche piece of athletics. But I love that. That was awesome. That's been incredibly beneficial for me. My last fight, I felt awesome. It was great.
You did great, man.
I appreciate that. That was a great fight.
That was a good fight. I had a blast getting to watch you.
I had these guys there, and we had a blast. It was awesome.
Yeah.
What's your guys' next step here? What do you plan on doing in the next year?
So our next plan is to introduce a limited rehab program. Because once you repair an area and once you restore function, once you've got that knee that can actually move correctly again, well, then you need to strengthen it. Because those muscles haven't been used correctly in a long time, right? And that's more your specialty, strengthening things. But we want to get patients started with that. We've got some older folks who, they're not going to be at that high level of athleticism, but they need to be strong. The more muscle mass you have and the better strength you have, better muscle activation, the more resistant you are to injury. So if you've got, if grandma falls, what everybody worries about breaking a hip, right? Well, that's because those muscles aren't supporting and protecting. Not only is bone density an issue, but those muscles are really important. So to be able to not only restore good motion to that, people are not only feeling better, but they're more resistant to injury and they work well on the long run.
Sure, and the thing is guys, laser isn't just for athletes. I was kind of brought in as part of that section of it, but I feel like athletes are really more of a smaller percentage of the people you work with. So I think this is most beneficial, probably for, everyday person,
right.
Being able to avoid surgery. I think that's huge. And then, just overall recovery of your body. But let's say you have an injury, you still have to be able to go to work. If you're swinging a hammer or, rolling paint or whatever it is that you do, especially the trades here with construction being so huge, your body, for a lot of people here locally, that is your moneymaker. So I feel like it's most important to take care of your health in that aspect because, if your shoulder's bad and you're trying to frame, you can't lift your nail gun, that's huge.
Yeah.
So I feel like it's even better as far as that goes because you can hit such a wide range of people. Laser isn't just for one section of people.
Exactly. It can work great for athletes, but even as you're, I'm getting into my mid-30s now, and I can feel it. I don't recover quite as quick as I used to, but I can use laser to help if I do something silly and get injured, or if I'm, when I go snowboarding for the first time this year, I know my legs are going to kill me. I can use laser to help out with that, right? But as people are, as we age, we're not used to that kind of decrease in recovery ability. And so you go out and something that may not have bothered you 10 years ago, all of a sudden it's just killing you and your body's not recovering. Laser accelerates that recovery and lets you get back to where you're supposed to be.
Absolutely. Awesome. So you guys, really appreciate you watching. Absolutely love interviewing Dr. Rountree here. It's been great. If you guys have questions, things like that for Montana Laser, I'd love you guys to drop that in the comments and we'll go ahead and start a discussion there. And then as far as where are you guys located here?
So we're at 119 East Idaho Street. We're just right east of Dairy Queen in Kalispell, across from where Sportsman used to be on the road.
You guys, if you ever have questions or anything like that, I highly recommend coming in and checking it out. It's an awesome program, super great people. The staff is, I love the staff. They're all great people. So definitely come in, you guys, if you have questions or anything like that, hit them up, and then let's start a discussion, the dialogue here. If you're interested or if you have questions on how things work, drop it down into the comment section, and we'll get back to you on that. Really like to start that discussion with you guys.